On today's episode of Your Life Redefined, how a smart pair of socks will not only feel good on your feet, they may also save your life.
When the color is changed red, this means very urgent care is required.
We're talking about diabetes, not only how you can live with it, but how you can also make your life better thanks to the wonders of modern technology. All this and more on today's edition of Your Life Redefined. Hi, I'm Dr. Anna Marie, and welcome to Your Life Redefined. We're on location at the University of Arizona in Tucson, where doctors are saving limbs and saving lives, all by redefining how we treat diabetes. 1 in 20 people have diabetes. That's almost 26 million people in the United States. And that's why experts here at the university are working to redefine diabetic treatment using new technology.
You're making me a happy foot doctor.
Podiatric surgeon Dr. David Armstrong is a world leader when it comes to helping diabetic patients save their limbs and ultimately save their lives.
Once someone gets an amputation, it's not pretty. It's worse than most forms of cancer. Your mortality, now your 3-year mortality is anywhere from, on the very low end, 30% to on the high end, 80%.
Matter of fact, diabetes is the leading cause of lower limb amputation in our country that's not related to trauma. That's why Dr. Armstrong and vascular surgeon Dr. Joseph Mills founded the Southern Arizona Limb Salvage Alliance, or SALSA for short. The program, based at the University of Arizona, includes specialists in podiatry, neurology, bioengineering, the list goes on and on. It serves as a model for interdisciplinary care worldwide. With diabetes, there's a buildup of glucose or blood sugar in the bloodstream. If left uncontrolled, too much glucose can develop into all types of complications like heart problems, kidney failure, blindness, and neuropathy, where you can lose your sense of feeling.
Diabetes affects anywhere between 26 and 30 million people right now in the United States alone. Of that, about half of those patients, half of those people with diabetes have or will develop some degree of what is called neuropathy, or the loss of feeling. And that happens because of a host of things, but it has to do with problems with the very small blood vessels down at the nerves, but it also has to do with inflammation around those nerves. So it's a metabolic and a vascular problem that causes that loss of feeling.
And that loss of feeling allows a person to wear a hole in their foot, just like how you would wear a hole in a sock or shoe.
That hole, about half the time, gets infected, anywhere between 50 and 60% of the time. And then after that hole, that ulcer, that wound gets infected, about 20 to 30% of those people will have some level of amputation in this country and around the world.
I mean, it was black as could be, the whole toe.
That black toe was dead tissue or gangrene. The risk of gangrene happens in diabetic patients when there are 2 complications, a loss of feeling and poor circulation. But at the age of 83, Jeanette refused to give up.
3 doctors, they wanted to cut it off. They didn't try nothing. They didn't even try the medicine, anything. Just, I didn't want my leg cut off. Can you imagine no leg?
This is right up there with a bad form of cancer. And by the way, we would never think of withholding therapy on someone who, God forbid, had colon cancer or breast cancer. It happens all the time in people that have foot problems. And it loads up our clinic because people say, well, I went to see the doctor and he or she, they looked at the wound and they said, well, you have gangrene, or you're going to have it. Looks like it's about to turn to that. Let's just cut your leg off and be done with it.
It was on Valentine's Day when the SALSA team performed Jeanette's bypass surgery, giving her blood flow back to her right leg and her quality of life.
I'll do everything I used to do. Mow the grass, water the plants. I like to do gardening. I'll do it again.
So we kind of try to make decisions not just based on a number, which is the age, but somebody's functional status and their physiologic age. So she's young at heart.
One of the latest technologies the team uses to outsmart diabetes is 3D printing.
It allows us to take something that we can see on an x-ray film, or we can look at on a computer screen, and we're actually taking it into the physical world with 3D printing, so we can actually look at these deformities and get a hands-on aspect of the challenges that we may be facing with surgical intervention.
This is just game-changing.
3D printing can help doctors plan the best surgical procedure to repair a severely deformed foot.
So this is an example of a Charcot foot, and you can see here he's sort of broken down more or less along the midfoot here. Charcot foot is a very unfortunate condition which can happen during a diabetic event with neuropathy. What ends up happening here is that because of the lack of sensation, they truly don't realize that they've worn out the joints in their feet, and they can become very inflamed, and the joints themselves actually just break down, and it's almost like watching a demolition of a building where everything just starts collapsing on top of itself, and it becomes very unstable for the patient to walk on, and is also incredibly prone for ulceration to take place.
This thermal imager locates hot spots fast. The device helps doctors outsmart diabetes by catching high temperature areas before problems start. Once a potential problem spot is found, offloading techniques like this boot help keep pressure off high-risk areas, protecting the foot.
You're seeing that what is the average of your velocity.
Biomedical engineer Dr. Bijan Najafi leads the team's mobile health program. Their goal is to measure how patients move through and interact with the world.
Some of the diabetes patients only pay attention to walking, and they feel that, okay, walking might be dangerous, but they forget about the standing period. But the standing period also is very dangerous because it's foot loading condition, and if you stand for long period of the time on one side and transfer the load to that side, actually it might cause development of foot ulcer.
And check out this smart sensor.
We can see also the actual data like the EKGs.
The sensor tracks in real time a patient's heart rate, respiration, and level of activity. It can even alert doctors via their smartphone when a patient is stressed out. Stress actually plays a role when it comes to wound healing.
We know that the stress impacts the outcome that we have. For example, may have some delay in wound healing. And it was very nice that in real time we can assess this one and see the different technique for management of the stress.
By 2050, the CDC predicts 1 in 3 Americans will have diabetes. Today's podiatrists are staying a step ahead by preparing future doctors. Dr. Jeffrey Page is the director of the Arizona School of Podiatric Medicine, which is only about an hour away from the University of Arizona and the SALSA team.
It's a great opportunity for our students to train there. They are exposed to cutting-edge research, the latest approaches for saving limbs and healing ulcers, and allowing people to keep those legs so they can continue to walk.
Here's some scary numbers. Experts say every 20 seconds an amputation takes place because of diabetic complications. And did you know that in this country, about half of those amputations will lead to death? That's why it's so important to redefine the way we look at diabetes and its treatment. We'll be right back. Coming up next, you probably have a smartphone, maybe a smart TV, even a smart car. But did you ever hear of smart medicine? We'll show you how technology can be a real lifesaver. Stay tuned. Your Life Redefined will be right back. You know, the best way to redefine how we live with diabetes is to be smart. Follow your doctor's recommendations, get regular checkups, and keep up with the latest treatments. Simple items like socks and insoles with the help of smart technology can prevent amputations by helping diabetic patients take better care of their feet. Take a look at how smart socks are helping this patient.
So you like this one?
That's pretty. I like that one a lot.
And then you got the butterflies. So you got to have the butterflies in it.
Fabrics and fibers have always been part of Pearl Badman's life, so it's fitting that she's turning to a smart fabric to help save her left foot.
When you have the sock on, and it'll show the doctors that you're getting a problem, and you've got to get it taken care of now, right away.
These are the points that we are interested more.
Pearl is actually one of the first patients to try this new pair of high-tech socks.
Smart socks are an extension of an interest we have in intelligent or smart textiles in general. These socks can tell us almost anything we want to know about people, but right now what they're telling us are they're identifying hot spots because a wound will heat up before it breaks down. So that's number one. What it also can do is it can also identify high pressure points. It can also identify areas of strain around a joint. So it can identify when a joint is bending up and down, and so you can quantify that. And that's never been done before.
When the color is changed red, that means very urgent care is required.
Smart socks use fiber optics. That's the same kind of light transmission now used for all kinds of things like the internet and airplanes. From the outside, they appear to be normal gray socks with red polka dots marking the major pressure points on the bottom of the foot. But this intelligent textile is embedded with sensors that can detect a hot spot or early warning signs of foot wounds or ulcers that may lead to amputation or death.
We cannot manage what we cannot measure. And this is really a true wise words that I try always to consider it and focus my research in that direction.
The Southern Arizona Limb Salvage Alliance, or SALSA for short, is one of 3 partners that receives more than $2 million in research grants to do a 3-year study on these state-of-the-art socks.
The circle starts to become a full color. That shows that the magnitude of the pressure goes very high.
Physicians, engineers, and patients hope they'll be able to prevent the diabetic pressure sores that can form silently and painlessly until it's too late.
And you bump into something, it's like, oh, or I cut myself. And it's like, why am I bleeding? And how come I didn't feel it, and things like that.
The toes on Pearl's right foot could have been saved back in 2010 if these smart socks were available back then. It was in 2010 when Pearl was diagnosed with peripheral neuropathy, or a loss of feeling in her feet, when she developed a foot sore. At the same time, she was diagnosed with type 2 diabetes. Pearl has had 7 surgeries on her right foot. It was diabetes that robbed her of all her toes. Unfortunately, this is a common story.
When I stood up, I realized that I didn't have a balance because, I didn't realize that your toes help with your balance.
There's an amputation now every 20 seconds. And that number is actually increasing, it's not decreasing. So it's probably more like 18 or 17 seconds by the time this airs.
More than half of all foot ulcers become infected. 1 in 5 will require an amputation. Experts say conservatively, a little more than half of those amputations will lead to death within 5 years. That's why Dr. David Armstrong and his team are doing all they can to save limbs and save lives. Another limb-saving solution for diabetes may be these smart insoles.
Again, it's another solution. Imagine that you are wearing a shoe and it might be a small stone inside of your shoe. And you may not notice it because you don't feel anything in your plantar area. So maybe this shoe can notify you, for example, through the watch that you're wearing or through your iPad, or can send a text message to you.
At the age of 63, Pearl is turning to medical gadgetry in hopes of preserving her left foot. Her only wish is to be able to pursue her passion for sewing.
This is my sewing foot. I can't have it. That's one thing I asked Dr. Armstrong, please let me be able to sew. If I can't sew, that's it for me. That's it.
I love these blankets, and they always smell so good.
Pearl and her husband get a lot of satisfaction delivering these blankets that she makes for the babies in the neonatal intensive care unit. She calls sewing her therapy.
Put yourself into it, and it's just, you might have frustration, she might be depressed, she might be, whatever, and you can put it right into what you're doing.
And that's exactly how the doctors and researchers feel about developing the latest innovations when it comes to outsmarting diabetes.
If we can bring those things to people when they need it, then, and the key information, without creating too many false alarms, that's the other thing, then we're really going to make a difference.
Finding hot spots in your feet can help prevent amputations caused by diabetes, and technology like smart socks can be just what the doctor ordered. For more information on how to keep your feet healthy, be sure to check out the American Podiatric Medical Association's website at apma.org. And we'll be right back. For more information about Your Life Redefined, visit our website at rl.tv. Coming up next on Your Life Redefined, you may think you're smart, and you are. Your body is full of smart cells that might just save your life. We'll explain how next on Your Life Redefined. It's now time for some trivia. People with diabetes may experience elevated temperatures on their feet called hot spots, which can lead to the formation of ulcers. True or false? The answer when we come back. Did you figure out our trivia question? Well, the answer is A, true. Podiatric research shows that people with diabetes may experience a rise in temperature in certain areas of the feet, which can lead to the formation of diabetic ulcers without medical treatment. As a preventative measure, a foot thermometer can indicate when foot temperatures are ripe for possible ulcer formation. Here's something that'll surprise you. The answer to outsmarting diabetes may lie right inside your own body. Experts here at the University of Arizona are finding there are smart stem cells in our bodies that can be used to heal open diabetic wounds. Let's check it out.
I think it's amazing. I just think this is amazing.
Catherine Romano is amazed by the fact that her body's own cells can become smart cells and help heal a wound on the back of her leg. Just 15 minutes ago, Catherine's blood was drawn up for today's non-invasive treatment.
It takes about 15 minutes to do all the separation.
This machine takes Catherine's blood and separates out her powerful platelet cells. The therapy is called platelet-rich plasma, or PRP for short.
Just like we have smart socks, we have smart cells. And those cells actually can allow for homing signals for a lot of the proteins and a lot of the growth factors that actually can come in, creep in, and help finish off what we've already done with that skin graft on your wound. And actually, it's really exciting. But you see all of this area right now. This is all healthy skin right up here. And virtually all of this is coming together as well. Remember, before we had a little bit of exposed tendon, a little bit of exposed tissue, and that was only a couple of weeks ago.
Tina Ontiveros and the rest of the blood recovery team are working with Dr. David Armstrong. They've been using platelet-rich plasma therapy for about a year now.
It's been very exciting. We've had patients that have come in that have had diabetic wounds for over 5 years, and we've been able to heal them in like 3 months. The body knows how to heal itself, and we're just helping it along a little bit.
In regenerative medicine, it just never ceases to amaze some of us that do a lot of this, how the innate intelligence of groups of cells, it's like a swarm of bees swimming around a hive, and for cells, it would be cells of various types signaling each other around a matrix. It depends on the matrix what they're going to become. But what we can do now is, whether we're spinning smart cells like platelets down in the clinic, or whether we're pulling marrow out of the bone, or whether we are taking adipose tissue and amplifying that in the lab, we can actually take cells that are early progenitor cells or stem cells and then deliver those into an area. And if they're in the right environment, they can grow up to be anything they want to be.
And for patient Pearl Badman, the Southern Arizona Limb Salvage team is taking cell therapy a bit farther. They're actually mixing her own potent platelet-rich plasma with another smart cell concoction.
So what you see in here now is actually some amnion that we're going to take, and this is from little guys, little babies' umbilical cords. And what this is a really potent immunomodulator, really potent anti-inflammatory.
Dr. Jennifer Papalardo explains how these amniotic cells can enhance the healing process.
It recruits the cells to the suburbs that we can get some nice growth to the area, and then we put the platelet-rich plasma right in the inner city so we can kind of get everybody kind of meshing well. So that's the idea.
Fibroblasts are kind of like the Willie Mays of wound healing cells.
From bioengineered skin to using a patient's own self-healing cells, it's an exciting time for outsmarting diabetic wounds.
I think that's a wonderful term, and trying to outsmart these sorts of things, because these diseases are smart and sinister, right? And so we have to be equally so.
Whether it's new technology or the wonders hidden inside our own bodies when it comes to dealing with diabetes, today's podiatrists are finding that it pays to play it smart. We'll be right back. Coming up next on Your Life Redefined, when it comes to healing, it's not what you put on the wounds that's most important, it's what you take off. And would you believe maggots can actually play a role in helping us heal? We'll explain how when we come back. Welcome back. So far today, we've seen how smart socks can detect problems in our feet, problems that could go unnoticed, and for diabetic patients, problems that could lead to amputations, even death. But high-tech socks aren't the only tool experts are using to prevent complications from diabetes. Some really old-time techniques can also play an important role. Would you believe we're talking about maggots?
Disgusting. For you and me both, but the job that they do is absolutely wonderful.
The idea of having bugs thriving on her body gave Barbara Shore the heebie-jeebies. But when faced with the choice between an amputation or maggots, Barbara, like most people, would pick the maggots.
They're nature surgeons, and they work 24/7. Maggots then only eat what's dead.
Which means the creepy-looking bugs are great for cleaning up diabetic ulcers that don't respond to standard treatments. Maggots do their magic when they're left on hard-to-treat wounds for a couple days. They remove dead infected tissues, kill off any bacteria, and speed up the healing process. Now keep in mind, these aren't just any old maggots.
Certain little maggot, that's the green bottle fly, or the green blowfly maggot, and that is the larva that is grown in one lab now in the United States, by Monarch Labs in Irvine, California. Those larvae only ate what was dead, what was not viable. And so they were basically like nature's little surgeons. Yeah, but they did wonderfully, and they didn't hurt very much at all.
I didn't feel a thing.
Do you see?
We caught up with Barbara to see how she handled being treated by maggots.
Well, I hated the maggots, but I was glad they were effective. He was pleased with them. I mean, they're disgusting looking creatures. You've seen maggots.
Yeah.
They're awful, but I never had to look at it because they had it covered.
Well, we've been using maggots for about 20 years. You're going to probably see it being used even more, especially as we move into what some people call a post-antibiotic world, a post-resistance world where we're really fighting a lot of superbugs. I think we're going to have to find some alternative means to fight this antimicrobial arms race, and the little critters might be one way.
Thanks to this natural treatment, Barbara is now one step closer to seeing her wounds healed. Matter of fact, she's already thinking about dancing. From maggots to modern medicine, Dr. David Armstrong and his limb salvage team are doing whatever it takes to outthink diabetes and to help their patients feel great both physically and emotionally.
Diabetes is indeed sinister. I mean, it is a silent, sinister syndrome, but we're onto it. And if we do it together as doctors and nurses and as patients, we can not only outsmart diabetes, but we can get out in front of diabetes and ultimately prevent it. And it's a very exciting time.
I hope you enjoyed our visit here to the University of Arizona and all that we've learned from the SALSA team and the research into the new smart ways to cope with diabetes and save lives. Until next time, remember to your life, live it, and live it well. Thanks for joining us. For more information about Your Life Redefined, be sure to visit our website at rl.tv.
Some great advice, and I would credit the APMA for this for sure, is knock your socks off. That's, if there was one thing you would do, just take those shoes and socks off, and what that will do for the clinician who is coming in there, and you got to feel for that doctor and that nurse. They have it hard. They have only a few minutes to check everything about you on a general doctor visit. But if you have those feet up there sticking right in their face, they're going to identify that problem, and they're going to say, oh yeah, I got to look.